average weight of men and women in America right now is more than a dozen pounds higher than it was in 1990. That's according to a recent Gallup poll. What has not changed, though, are the rigorous standards to protect our country.
And that's causing some members of the military to go to extremes to pass the so-called tape test.
Well, tonight, News 4 San Antonio's Melissa Vega is digging into what they're doing, not only to look physically fit, but also to secure their family's future.
They make the ultimate sacrifice for our country. Our heroes, the men and women who protect our freedoms.
Military people are still human.
That's exactly why some may be going in for a little nip and tuck.
Are you seeing more military men and women opting for plastic surgery to pass the fit test?
The difference between a military and an average citizen is that there's a tape measure test. And even when you're fit, and you're considered fit by me, a tape measure might not consider you fit, which is unfair.
The tape test measures body fat by calculating the measurement of the neck and waist, plus hips for women, and comparing it to height and weight. Only certain service members have to take the tape test, and before they do, certified plastic surgeon Dr. Thomas Jeneby says he'll see 5 to 10 of them a month for liposuction.
They come to me and they say, I'm fit, I can run a mile in 7 minutes, I can do a ton of pull-ups, I can do a ton of sit-ups. I'm not going to pass the test like this.
One of Dr. Geneby's clients spoke to News 4, but didn't want to be identified.
Well, for the majority of the women that do the tape test, it has to be based on their measurements from their neck, their waist, and their hip line. And majority of the women have that problem where it's in the hip area.
She had fat taken out of the lower part of her upper thighs.
I don't regret it because I did really well on my fitness exam. It made me feel a lot lighter. I'm more confident.
She says passing the tape test goes far beyond physical fitness. It can delay promotions, and if you keep failing, it could even lead to a discharge.
You have that one thing that hindered you. That could separate you from the rest of the crowd.
By no means is surgery a permanent fix. Military members still have to work out, eat right, and maintain their shapes. Melissa Vega, News 4, San Antonio.